Technology and staying current with technologies is an integral part of our practice. To ask me what technologies we use is almost a difficult question for me to answer because technology is fundamental to our practice. Dentistry is a fast-moving field. It is changing all the time. And just as part of our routine process, we're looking at new technologies, watching them as they're being developed, and integrating those technologies when we believe they've reached the point where it's appropriate to integrate them. Our practice was one of the very first, I think when we went to fully chartless digital x-rays, there was less than 5% of the practices in the country who were chartless and had digital x-rays at that time. We've used digital x-rays for 15 years and saved an incredible amount of radiation exposure by making that switch early for our patients. We use the cone beam technology for placing implants, which allows us to look at things from a 3-dimension. That's a great new technology that we've brought on board. We have the same-day crown milling technology, which I actually became interested in that many years ago when I first started in dentistry, when it was a very strange and a weird concept, and I watched it develop and brought it in at a time when I thought was really appropriate. So we've had it in our practice for about 10 years now. I also have Veloscope technology, which because I've been involved with an oral medicine study club for many years, I was able to see, before it was even approved by the FDA and was actually being utilized in research at the University of Washington through my study club, where I'm up there every year looking at oral medicine concerns. We saw that during its development, and once it was approved by the FDA, we brought it in very early because I was very familiar with it. So we use a large range of technologies. I don't think of technologies as separate from something in my practice. I think it's really an integral part, and it's something that goes hand in hand with the procedures that we utilize in our practice.